All the materials are evidence-based. Am I supposed to talk? Meaning that they come from research. There's a self-assessment tool. After you finish one module, you take and you see whether you are smart or not so smart. So I decided to do one for prosthetic, and I failed. I shouldn't say. So you see, I don't know certain things. Let me play this.
Content areas, theory and principles, clinical applications, and the ITI Consensus Database. Let's start with a closer look at theory and principles. Theory and principles is made up of learning modules and Congress lectures. These cover a multitude of topics to provide the theoretical foundation for success in clinical implant practice. Now, let's turn to the second content area, clinical applications. In this area, you will find learning materials that show how the theoretical knowledge presented in theory and principles is applied clinically. Case reports and videos covering a broad range of clinical scenarios are available here. The last of the three main content areas is the ITI Consensus Database. This database is free of charge to all users. The Consensus Database presents the proceedings of the last three ITI Consensus conferences in the form of consensus statements and clinical recommendations. The corresponding review papers are also available for download free of charge. When taken in combination, the three content areas of the ITI Online Academy will provide you with all the knowledge and information you need to be successful in scientifically driven, evidence-based implant dentistry. The ITI Online Academy, state-of-the-art education.
So this is a nice video to introduce what the Online Academy does. I will show it to you personally. So it has all these tools for you when you treat your patients in the clinic. And for you to have a self-learning. So the learning, it's many ways. Handouts, so you have the same thing, like lectures like that. You have videos, they even have videos. So you have, if you want to learn about implants with bone grafting from Professor Boozer, they have a video there. Wow, that's great, right? And they have assessments, I told you about that. They have papers or recommendations that I shared with you. I was part of the group, right? They have risk assessment tool. When a patient comes in, let's say there's this nice gentleman who wants to come in for an implant and says that, can I have this? Then I run through the assessment tool. Are you a high risk, very difficult, or very easy? Then you show to the patient, I say, hey, you are so difficult to treat. Like I said again, you want to look like George Clooney? No, maybe someone else. Okay, the risk assessment. They have pictures and presentations of previous conferences. Everything is inside, but you have to be a member, I'm sorry. Because it's a win-win. You want to get your membership, but we give you. The three useful platforms, guys, that you all need to know are these, okay? When you use the ITI. So I'd like to show you one step at a time. The first one is the global forum, what I call the blog site or the Facebook page. So when you go in, that's me there, and you go into the global network, you see what people write here. You have 17,000 members worldwide. Out of these 17,000, we have people with different experience. Because someone might be in Nepal, Kathmandu, on the mountains, and he's in charge of taking care of some of his patients. And all of a sudden, he has this implant failure, and he doesn't know how to treat. So what does he do? He calls, he doesn't know what to do, right? He said, Dr. Yo, can you come? I said, no, I'm here in Yangon, I can't come. So he puts this block there and he types, help, patient with implant failure. She showed an x-ray, take photos, put on the blog site. And then you know what? All of a sudden, hundreds of people all over the world, even Professor Boozer and people, they were just saying, okay, do this, don't do that. Fantastic. If you don't like to be answering questions, that's fine. You just go in there and you learn. You see what people do in terms of successes. You see what people do in terms of failures. And then you learn. Okay, so it's fantastic, you know. Just go in there when you have the time and just look. Different indications. Apartment fracture, what do? Sometimes they use the non-Strawman stuff, you know, they use like a scalar thing, you know, just remove it, you know, things like that, some tricks. Okay, so this platform, it's so amazing. I need some technical advice here. Can I go online? Is it okay? Yeah. But it's not showing, so what do I do? I just want to show them what I'm doing right now. I'm really on Wi-Fi, but it's not showing. Maybe I need to go up. Give me a moment, guys, because I'm going to show you this on the website. Oh, what did I do? Okay, are we here?
No, it's not.
So when you're on the ITI website, you have all these links. But, okay. So this is the discussion board. Okay. Okay, I need to log on. So don't look at this. Can you see what is being discussed right now? Okay, do you think we can get some technical guy? Oh, they are doing that. Okay, I'm trying here. Okay, so let's say if there is a clinical forum and you want to check what's on the blog right now. Okay, so if you are keen to look at surgeries, what are the active blog threads that are showing? Okay, so one guy, his title is contour augmentation in the posterior maxilla. So you click onto that, and then these are all the 315 views and discussions out there that's talking about this topic. So they will discuss about, oh, what do we do? What's your recommendation? Some people will come in with their own guidelines and stuff like that. Okay, so this is the blog site that you can use. Okay, it's kind of difficult here because I don't know why it's not really showing up. Okay. So, 3 platforms. The first platform is the Global Forum, which is the blog site. The second one is your assessment tool. Okay, Now, we go back into the website again, and hopefully I can show you guys. I am connected to the internet. But you know the screen is not showing because you see I'm online right now. Because I'm not even seeing my arrow on my screen, I'm just doing it blindly. What do I do? You? Why don't I borrow your laptop and I just go online? Does anyone have a window? Okay. Alright guys, hang on. Okay, so when you log on to this is your global forum page, yeah? This is your own account. Right? So on the top left hand side is where your forum discussion board is. Okay? And then you have documents that you want to look at, consensus papers. You have guidelines. If you go to documents and media, guys, you look at this. You see, your treatment guide is here. It's inside here. Your literature update is here. Your SAC classification. This is what I'm talking about. The second platform that you guys need to know is the SAC. What is SAC? Simple, advanced, and complex. Then you group the cases. Is this a simple case? Is this an advanced case or a complex case? Now, the thing is that it doesn't mean because I'm an experienced surgeon, everything is all simple. It doesn't work that way. If it's a sinus floor elevation, open window, it's always complex, whether you are experienced or not. How I use it in my school is that when the students come in and in a university program, right, 3 years for periodontology, okay? In the first year, we give them the simple cases first. When they are in their second and third year, then we move to the advanced and the complex. Same thing, it works for you guys. If you are just started in implant dentistry, don't have your first 5 cases advanced and complex. Sure. Always go for the simple cases first because you need to know, right? It's just like wisdom tooth surgery. Right? After, 50, and then you start getting very, very, very good. You need to have that level of experience. So, I will show you. So, when you have the SAC classification, okay, ITI.com. Maybe I'll just use yours. I'll put in my password. I will try to use Mr. Charlie. Yeah, so change to yours. See whether I'll put this down. It could be because maybe. Could be they are protected. It's okay. I think I know how to do it on mine. Just that it's a little bit troublesome. Alright guys, sorry for that. Let me try my best because it seems that the PowerPoint works, but the website can't really see so clearly. Okay, so you got SAC classification in English. Alright? So you click on this. I want to show something on the net. PowerPoint keynote circle, but when I show it, yeah, this is good. This is good. Can I do this or what? Screen. Where did my picture go? Okay, hang on. English. Huh? So you can't. My screen is completely blank. If I refresh this, okay, it's not sure. Very useful because I will try to show again tomorrow, but it's so important because let's say when you treat this case, okay, the patient comes to your clinic and then because you are an ITI member, you open up this SAC assessment tool and then you do your diagnosis and treatment plan. So the patient comes in, how old are you? You take, okay, female, male, medical history, blah, blah, blah. Do you have any other dental problems? No dental problems? Or full mouth caries, huh? Full mouth gum disease. So you tick, tick, tick. The SAC tool has a tick, tick, tick kind of thing. So it's very easy. You click one button, you go to the next page. They'll help you to ask the question to the patient. Medical history, lip line, biotype, how big is the space? Because sometimes when you deal with implants, one missing tooth here, if your space is too small, how are you going to make sure that it looks nice? If your space is too wide, what do you do? Put in one implant or you put in two? You come up with a list of 20, 25 questions. At the end of the day, you click enter and then the computer will come out and will tell you that your patient is complex. Or you will tell you that the patient is simple. Because the patient thinks that every implant case is so easy. And he thinks that you are going to get a good success, but actually he's classified as complex if you don't tell him on the day of diagnosis and treatment plan. And if you have a problem after 3 months, it's your fault. But on the day of the examination and diagnosis, if you come up with a plan and you say that, hey, sir, you are a complex case, then the guy was like, okay, I understand now. So the expectation goes down. Can you see that? Right? SAC classification is also good for you as a dentist. Because enter, it comes out and it becomes complex. Do you want to take it? If you are just started with implants, I say maybe no. You refer to a professor or a friend and then you just go to the clinic and then you observe. Huh? This is what it means. The SAC is very important, especially right now in Singapore where everything is, they want to sue you, you want to bring the case to the court and stuff like that. Okay? The guided learning online academy is so important because when you're on the online academy, this is the third platform, you can choose different kind of learning pathways. If you are very new to the online academy, then you should start with topic number 1. If you are very new to implant dentistry, then you have to do topic number 1. If you are a very good surgeon, then you only need to focus maybe on the prosthetics. If you are a very good prosthetic dentist, then you maybe want to learn something on surgical. Then you look for it. Okay? I have a video here, and we will talk about how the online academy can actually help us.
Learning Pathways allow you to systematically select desired learning content for individual topic areas in the ITI Online Academy. Learning Pathways group theoretical knowledge and examples from clinical practice into content clusters to cover individual implant dentistry topics comprehensively. Learning Pathways can be explored using the keyword taxonomy or the pathway map. The pathway map is divided into 6 main branches that can be expanded to reveal their subcategories until you arrive at the topic you want to learn more about. The learning pathways are located at the end of each branch on the map. All active pathways are shown in color and can be examined with a click. Pathways explain and illustrate learning topics by combining the theoretical knowledge from the theory and principles area with examples from clinical practice taken from the clinical applications area. They are tailor-made packages.
So can you see that? Do you see the video? You have videos, you have lectures, and you have a lecture, let's say someone filmed it and put it on a website, and then you can learn about my topic, for example, soccer preservation. Wow, this is crazy, it's amazing. We counted, there's about 500 to 600 topics out there, all small little ones. Yes. So this is what we mean. So the ITI Online Academy, we have 6 topics. Introduction into implant dentistry. So they talk about osseointegration, the role of implants in the beginners. So to me, this is very good for 2 groups of people, undergraduates and for people, let's say, we just started in this new field, implants. You want to learn a little bit more. Okay? It's something like you learn once and then that's it. But it's good to get a nice overview of things. Then it starts getting even more in detail. See, practicing implant dentistry. So they talk about drilling sequences, what do we look out for, even preparation of your patient, how to do infection control and stuff like that. Wow. Then they start teaching about treatment planning, like the SAC. Okay, one favorite topic of mine is the aesthetic SAC. It's this aesthetic assessment, but this is not a good platform. I'm hoping to come back in the second half of the year and focus on aesthetics. Then you have one section on prosthetic, one section on surgical, and what I like about this is one whole section about outcomes and care. Because a lot of the times no one talk about implant care. Okay? So introduction into implant dentistry, you see, you open this and you have, it's like a tree branch, it starts opening. You click on this, there's more subcategories, subtopics. That's why it came out to about 500 to 600 topics because of this. If you're a member, it's 100% free. Previously, 3 years ago, as a member, you had to buy credits. Going to the casino, you buy coins, and then you go in and open it up. But now, everything is free. So this is it. This is it, guys. If you go into treatment outcomes, you open it and look at outcomes. This first one talks about survival and success. You know why I'm telling you about this? Because I did that. So my topic is here. You can see my younger and inner version of myself. My face is dead. So I was involved in this. When you are keen to look at videos, you look at videos here. When you are keen to look at presentations, there are presentations here. Wow. There's even presentations of old congresses. This is it, guys. Can you imagine how powerful this is? Right? Because I can't teach everything. I can't. Because I'm only good at certain things, let's say. Okay? But these are all experts from different views putting inside, and then this is meant for all of us to share. That's why the ITI Online Academy is so powerful. You guys just really gotta get it because it sets you at a very different level. Remember what I say? First movers. You have to be the first guys. Right? My conclusion this morning, before we go to a coffee break, okay, is that to me, implant and aesthetics are the next Invisalign implant dentistry. Okay? Although the results are very, very high, you get very good success and survival with implants. But if you are the guy that did wrongly, you have 100% failure. And everyone knows him as the problem dentist. Really. I would rather know the skills and what are my limitations. If I'm not good at aesthetics now, I just refer the case and I learn. To me, dentistry and implant dentistry education has evolved. Okay? So we now need to move into the smart generation. Okay? That's where I talk to you about the online stuff. But there are many ways of education. You study from magazines, from journals, you attend courses like mine, study clubs. You really have to use a study club. Okay? You go for the KL meeting next week, we organize it for you. You go for international meeting, that is, doesn't have to be ITI, but you have to be on top of the game. And last but not least, we have the online academy. I wanted to show this online, and I really hope that the internet works one more last time for me, because this is so interesting. Let's go on. I always talk about George Clooney, because he's my wife's favorite actor, so I try to be like him, hopefully, looking more handsome, not so fat. Even celebrities and superstars have dental problems. This is a very funny video. You guys got to listen to this. Okay, so one last time with the web. I hope this works. This is what I mean. Even the guys with the most money and most famous in the world, they have problems. Why? They see the wrong dentist. You know why the dentist is wrong? He doesn't follow the ITI concept. This is a very good example, ladies and gentlemen, and I would like to close this morning by saying thank you for this one before we go for our coffee break. So we set the stage right now. You know, I've not really talked about anything yet. Okay, the exciting part comes after this. We've talked about what ITI can offer you. I really hope you guys will take the opportunity to sign up. I'm meeting up with the president of the ITI and his team next week when they come down to KL, and I'm asking for even better rates. Because here in Southeast Asia, we are not rich, right? Because in Switzerland, their minimum income, I think, is about 3,500 Swiss francs, you know, for the cleaners on the streets. So even the dentists, they earn quite a fair bit. But the thing over here, very interestingly, is that I have an Indonesian friend who works as a young professor in Jakarta. he tells me that every month he earns 500 US dollar. You know, you don't really earn so much when you are so young and when you work in a university. But the ITI membership was 500 US dollar. So if you do the mathematics, what will you choose? I would choose not to sign up, correct? So we have brought down the subscription rate actually quite low. We are now about $300. I mean, it's still high, but if you look at the implications and the advantages of this, it's mind-blowing. Okay, because it sets you at a very different level from the rest of your friends. All right, ladies and gentlemen, I'd like to end just this short section. We have a 15-20 minute break. And thank you very much for your kind attention. Yeah?
Yes.
Thank you.
Thank you.
Can we have some coffee? Okay.
Okay lah.
Difference between success and survival in your understanding? What is different? Okay, and survival, it's surviving for a long time. So her answer is success is maybe on that time when you place the implant, and survival is over a long period of time. You are right, you are half right. You are half right, but there's actually more to it. Before, when implants started coming about during the Brenner Mark, the Nobel, the early Straumann days, and now you have all the Korean and Chinese implants, right? The suppliers will come to tell you, oh, use my product because it's 90% survival, 100% survival rate. And when you look at it and you listen, when I go to school, when I get 95%, I'm so happy, right? 90% is very good, okay? But there's actually a difference between survival and success, especially when you choose things, biomaterials for your patients. And these are actually definitions in the medical and implant dentistry world. When we look at success, we look at cases like that, okay? These are basically for the next round of aesthetic lectures. Patient comes in with different situations, different scenarios. At the end of the day, they want an implant. When we give them this, my cases that I usually show are 2, 3, 5, 8, 10, 12 years. I go for quality and longevity, because it's not that something I teach now doesn't work next 1 year later. You follow up the patients and you know that your cases works. Okay? 4 years, 3 years, 8 years old. So the concepts I'm teaching you right now, you know it works and it will last. Because anything can happen into the mouth, anything can happen to the patient. What? Medical issues, all of a sudden the patient got diabetes. All of a sudden the patient developed periimplantitis, right? You want to minimize. Does it mean that implants, I do implants, have no problems? No. I try to minimize my complications. But by and large, this is what we call success. We have success in aesthetics, we have success in patient satisfaction, we have success because we have no bone loss, and we have success because there's no infection. Okay? However, when we start looking at survival, it's a totally different definition. Okay? The definition of survival is like that. It means that the implant is inside the mouth. That is what it means. When you see cases like that, look at the implant, it's placed wrongly. Look at this implant, it has an infection. But the definition is still 100% survivable. Definition of survival means implant in the mouth. If the implant is still mobile, it's still 100% survivable. You've got to be very careful, because some of these companies, they say, I have 100% survival. Because to me, this is 0% success. We cannot have this in our clinic. Or we have to minimize our failures. When we look at patient and basic site analysis, right, for implant dentistry, these are the few things that we need to look out for. Because now we are just starting at an S level. Okay? We look at certain S classifications. We look at medical status. Obviously, okay, what kind of profile? We look at gingival biotype to help you. We look at the surrounding bone. We look at the gap. Is the gap too big, too small? Okay, stuff like that. We look at occlusion. Okay? Now, this situation here is basically talking about treatment planning, not in the aesthetic zone, but already we are talking about so many things that you have to consider. Doing it in the first premolar, in the first molar, and yet you have to think about so many things. I'm not even looking at high smile line, stuff like that. We look at the status of the dentition, we look at X-ray diagnosis. Medical history, why is it so important? I like medical history because when a patient comes to me for a 1 hour consultation, it gives me the opportunity to do an SAC classification. Gives me the opportunity to tell the patient, I'm here to listen to you what you want, and then we work from there. The patient may just want, I just want to have an implant crown. You don't have to give him a CAD/CAM CEREC, all ceramic kind of thing, because it's so expensive. All he wants is just to eat. You build a nice relationship with the patient or the family members, okay, during the first consultation visit. And then you manage the expectation. You know why? After doing all this, and then you press enter in the SAC classification, you tell the patient, I'm so sorry, because your lip line is so high, your biotype is so thin, you have gum disease, everything is all shrunk, you get black triangles. When I do the anterior implant, you're going to get black triangles. Then the patient understands. And you see, if you don't tell them this, and if your implant gets a black triangle, it's your fault. When you assess the patient, whether the patient is suitable for any form of surgery, implant surgery, gum surgery, wisdom tooth surgery, you check to see whether there's any risk factors. Okay? In the medical world, in the oral maxillofacial section, they like to come up with a medical risk score. They call it the the ASA classification. That's what the American anesthetists use to see whether this patient is classified 1 to 6. Very briefly, look at 1. 1 is when everything is very healthy, no medications, no medical problems and stuff like that. Then you have mild systemic problem, right? High blood pressure, a bit of cholesterol, that's fine. Then you have a little bit of severe systemic disease, okay? But that doesn't mean that we don't do. So typically, my cases are 1 and 2, a little bit of 3. I mean, we're not going to do this, right? 5 and 6, because these are meant for the medical classification, right? Like cancer treatment, transplant, and stuff like that. So for us dental, we do 1, 2, 3. Because some cases, even though they have severe, let's say the patient just went for a angioplasty or a balloon or a stent, is classified under 3. Is placed on blood thinners, right? So these are dangerous, but after 1 year and they get clearance from the cardiologist, it becomes a manageable 3 or even back to 2. Can you see that? So I will stick with this 3 classification, okay? So ASA 1, very easy. Come in, young patient, no issues at all. Number 2, well controlled. Even diabetic patients who are well controlled are very easy to treat. Okay? Mild asthma, high blood pressure, even epilepsy, Parkinson's, you can still manage. Because as you see, the patients are getting older. They're going to get old people problem. ASA 3, this is when you require your medical colleagues to help you. Okay, severe hypertension or type 1 diabetes. Okay, so you have to check, oh, I'm going to do this surgery soon. He said, okay, you check the HbA1c, chronic obstructive pulmonary disease, some severe lung problems. Sometimes you can, if the patient is on steroids, you just talk to the physician. Or if the patient are on long-term steroids, do you want to do? Maybe not, stuff like that. I'll teach you. Mild cardiovascular disease. So if the patient just had a stroke, heart attack, do you want to do the implant right now? No, you've got to wait first. Right? Why do you want to have a nice tooth there when the heart is not in function? Right? Recent ballooning of stent, after 6 months you can consider everything, then you can start changing the blood thinners, because you don't want to be the dentist that tells the patient to stop the warfarin, and then the patient bleeds on a jam because you want to put a damn implant inside, right? It doesn't make sense. So medical status, very important. Okay? These are the several 6-7 classifications that I just briefly want you to know about. Okay? Because we need to understand how it works. So we have hormone issues or diabetes, okay, bleeding disorders, bone problems, disease that affect wound healing, bone, medication, and smoking. We talk about diabetes first, okay? So very easy, in a broad nutshell, we use few factors to determine whether the patient has diabetes or not. Is fasting blood glucose, but something that is more accurate is the HbA1c. Okay, so anything below 7 to 7.5 is what I consider normal. But I understand that as a patient gets older, my mom has diabetes, so as she gets older, now she's past her 75 already. They mentioned that it's very difficult for them to control. So sometimes 7.5 is considered normal for elderly patients, but it's not considered normal for a young patient. So you need to know. So 7 to 7.5. If it's 6 point something, is great. Why I say this? Because patients with diabetes, they have problems with blood healing. The vascularization is very poor. When you raise a flag, you see cases where they look like that. Crazy. Do you want to be the dentist that deals this? Wow, you get heart attack, really. Once in a while, I get cases like that. Okay? Okay? And I get very scared. Even now, after 22 years, I do implant, but I don't feel correct because the patient is suffering underneath. So that's why, is the patient okay? 8.5. There are few things that affects the patient's blood sugar. I have an uncle that met in a road accident. All of a sudden, when the doctor did his blood test in the hospital, his HbA1c went up to 44. Because when the body is undergoing a lot of stress, it just goes up like that. So if you do anything, any funny surgery, it's not going to heal. Okay, stuff like that. So when a patient is undergoing stress, they have issues with the blood sugar control. Next on the list, another hormone problem is thyroid. This is something that we didn't really learn so much in dental school. But in my personal experience in the last 5 or 10 years, I got some ladies who were undiagnosed thyroid issues. And I placed implants in the maxilla and it worked. And then 5 years later, we had some problems in the bottom and we took out the teeth and I wanted to do implants. I placed in 4, 3 failed. Wow, I never get so much failures in my life before. For me, it's not good for my reputation to get so many failures. I placed 3, 1 failed. So I've been doing surgery and it keeps on, I just wonder why. Is it Dr. Yo not getting good anymore, or is it the patient? Patient went for a medical test, thyroid problem. Thyroid glands secrete the hormones that affect the metabolic rate. Okay? Thyroid hormone affects the bone metabolism, the calcium intake and uptake. Okay? Because it will help to affect the dynamics of your osteoblasts and osteoclasts. We know that. So the remodeling, the bone loss and the bone gain is not balanced. And that's the reason why, if you do a simple surgery, flatness sometimes is fine. But when you raise a big flat, wow. Then you have to start thinking. You're the doctor in charge. This is an 80-year-old patient. Do you want to do this on a patient like that? No. Do something simple. If it's a young lady, okay, you have to start planning. Get the patient maybe half a year, put it on some thyroid medication with the doctor, stuff like that, and then you try. First time, if it works, it works. If it doesn't work, try again. But if it fails again, maybe the body just cannot take surgery. You have 2 kinds of thyroid problems. Overt means too much thyroid hormones. Hypo means too little. Okay? This is the statistics from the States. Unfortunately, women are 10 to 15 times more at risk to get thyroid problems. Alright? And most of the time, the thyroid problems are below, hypo. So we give them T3, T4 thyroxine just to balance things out. So when I deal with cases like that, how do I, in my head, treat the patients? Do I just follow? No, I start thinking. If it's an elderly patient, maybe I don't do. Give them a bridge or a denture, right? Things like that. If it's a young girl, 21 years old, you want to help her. What else can I do? If the patient smokes, maybe not, right? Check other medical problems. If the patient is wants to bring to have an implant, then of course I choose the best implant in the world. Why? Good results, good healing. These kind of cases, I like to use the Straumann implants and the better generation, the SL Active. Have you heard about that before? The healing time is decreased. That means the patient don't have to take so long to heal in the bone. Because the SL Active implants, you see, will heal very fast within 3 weeks. So this is what I mean. You need to know your products, you need to know the evidence, and then you deliver it to your patient. Bleeding disorder. Sometimes you see patients walking in like that. That's why you use your consultation visit. It's so important. Because always I look at the patient, say hello, then I see how they walk in. Do they walk with a gait? Okay, their hands, are they bruised? Because these are signs of bleeding issues or cardiac issues. So we have over here hemophilia, patients who don't heal so well. So already the clotting is poor. We have impact clotting from these kind of cases, thrombocytopenia, liver disease, clotting factors. You see what we call these bleeding spots. Petechiae. If you are the dentist that makes the incision on a petechiae, that's it. Bleeding. Wow. You are going to be famous. Really, for the wrong reason. Right? Seriously. You see, have I put in the implant yet? No. So this is what I mean. You don't even know the basics. Right? I have a case not for implants, to do a gum surgery. This patient had this kind of thing in the mouth. I wrote a letter to the hematologist and then we planned. 3 months later, the patient before coming to see me had an injection of some clotting stuff. Then came and said, I quickly do the surgery. Within 45 minutes, suture everything, go back, and then the hematologist did something, and then I see the patient every day. Wow, it's not easy. It's stressful, but someone has to help them. So are you comfortable? If not, you refer. Refer to your not so good friend next door. No. Okay? Bone disease, we have more and more people, unfortunately again women, getting osteoporosis. The bones get less dense, and you know that the healing is not easy. So don't do in such cases? No, I just have to understand, and then you talk to the lady. Okay, first what I do, I tell the lady, follow protocol. I use the Straumann SLActive implant, and then I delay everything. I say, why don't we wait and let the healing go before we blow? You know, stuff like that. You have to switch things around. Okay? Because in a healthy bone, it's very dense. In an osteoporotic bone, it's very porous, because you don't really know how the healing is going to be like. Osteoporosis is defined as a decrease in bone mass, porous bone. Very, very cancellous and very, very spongy. So the cortical component is very little. There's an increase in bone fracture, and according to the World Health Organization, it's 2 times the normal standard deviation of the bone quality. So if you are 2 times the normal, then you're so-called considered as dead. Now, why is osteoporotic patient very important? Because they come with a different problem. Can I ask you a question? Besides the osteoporosis problem, what other problems can they have when you're dealing with osteoporotic patients? So this is a question to the floor. What is the extra problem that osteoporosis patients would face when you are dealing with surgeries? Who will be able to answer this? Because the guy that answers this will get 1 free SLActive implant from Udon Smith.
Really?
I'm going to answer, then I'm going to get 1 from him. It's the medication. Bisphosphonates. Oh my goodness, it's a crazy thing. Then you're going to get it's like osteoradionecrosis. Bisphosphonates controls cancer. Bisphosphonates controls osteoporosis, but it causes the decreased metabolism. Wow. I have cases when I took out the tooth, it took 3 months to heal. It's like a nightmare. I haven't even put in an implant. Can you see that? So this is what I do. Now in Singapore, some of the medical doctors, they are quite current. If a patient wants to get if a patient has osteoporosis and they're going to put on bisphosphonates, sometimes they contact the dental physician. We're going to do this quite soon. Is there anything that we want to do in the mouth? Extractions, wisdom tooth, implants, we do it first. Okay, can you see now how just by understanding that the patient is on osteoporosis and with bisphosphonate, you change the whole treatment plan for your patient. Paget's disease, you have a bone that are too fibrous, very, very soft. So that's why the bone doesn't, the spinal column is not so good. Some patients, when they have this, the implant healing around the mandible might not be so great, because this kind of Paget disease usually affects the bone structure. Sometimes you can get fractures. So you're the guy that does the implant placement, la la la, da, da, and then you fracture the mandible. Right? Fibrous dysplasia, you have massive growth, and then it starts pushing everything. Okay? But for us as dentists, we see a missing gap, we cut and then we put in an implant, right? We can't do that. We have to know. Alright? Because these kind of cases, the bone is not great. Now, this is something that we deal with almost quite often. Not very often, but once in a while. It's called osteomyelitis, or what we call as dry socket, or what Mr. Clooney called as air socket, right? He got this problem. It's a dry socket. Basically, it's a local infection for whatever reason. Smoking, trauma. If you take out the tooth after 5 hours, of course. Yeah. So you're going to get cases like that where the healing doesn't come. Maybe you have smokers or patients with diabetes, and you get a local infection. Okay, osteobone myelitis is infection of the local bone. You get bone necrosis. You get severe pain. I just got this like 2 weeks ago. On a 75-year-old guy, I put in some bone graft, and he got sequestrum. Right? So I had to take it out, clean, refreshen the wound, put the suture again, and then tie it all over again after 3 weeks. And then now antibiotics, and then it's okay. These are common day stuff. You have to be confident enough if you want to do implants. Okay? Radiation. Patients now coming in with different kind of cancer, head and neck. Sometimes with lymph node cancers or breast cancer, sometimes the radiation goes upper, and then we need to understand. I do not know how it works here in Yangon, but I'm sure it's quite the same in Singapore. Everything is all covered up. So the radiation is very localized. So they cause less damage to the surrounding tissues. But the radiation in the head and neck, I would wait first, because this is something that sometimes it works for you, sometimes it doesn't work, okay, according to research. So if you are just started in your first 10 cases, I say just forget it. Just send it to the hospital. Basically, they need a total of 66 to 68 grays of radiation energy. Okay? So that's the amount of radiation energy that is inside the bone. And the incidence of getting osteoradionecrosis is anything above 45. So you see, just to treat the cancer, the bone is not good. Right? So sometimes we wait 1 year, then we get clearance, and then we start doing. And then you do full mouth? No, you just do maybe 1 or 2. This is enough. We come now to the topic, which to me is very important, because it's not a medical problem per se, but because the patients have medical problems, they are on medications. A lot of patients right now, some of you here might be taking some medications, and we need to understand what kind of medications they are taking, because this would affect our end outcome of any surgery that we are doing. Okay? Wisdom teeth implant surgery, steroids. Steroids come in many forms: prednisolone, dexamethasone, cortisone. Now, the reason why patients are on steroids, the purpose of steroids is almost like an anti-inflammatory. It reduces the body rejection of certain things. If the patient has an immune problem, and we know right now in the world, we're getting to see more and more diseases. So immune disorders is SLE, skin issues, or other so-called body organs, ulcerative colitis, rheumatoid arthritis, skin lesions, sometimes eczema. Patients are on long-term steroids. Some patients who go for organ transplant, in order for the body not to reject the organ, they are on long-term steroids. So these steroids, they are very good. They are anti-inflammatory. But inflammation is a two-edged sword. You need inflammation for your surgery to work. When you do a surgery, you get inflammation. This inflammation is the body defense. Body needs to defend the foreign bodies. But if you put steroids and you remove the anti-inflammatory, then if there are infections, the body cannot defend. Can you see that? So that's why steroids is good and no good. Okay? The side effects for long-term steroids are, it will reduce the patient's blood pressure. So sometimes patients got to be careful. You know, if they don't eat, they get a little bit faint. Surgeries, you want to do it fast. When I was a student, my first surgery took 3 hours. You know why? Because I had to show my surgery to the professor. So make everything very nice. But you know what? I think the gums all died after 3 hours. You want to go in fast and then you come out. Steroids lower blood sugar. Steroids cause poor wound healing sometimes. Again, how does this impact us? You choose the best biomaterial product, you choose the implant that works for you, shorter healing time, as are active. Okay, you load immediately? No. You do an aesthetic side, you wait. Okay, you put antibiotics maybe twice as much. Instead of 5 days of Augmentin, you put 10 days. You got to start thinking. You see the patient once a week? No, maybe not. Every 2 or 3 days. You just want to follow up the oral hygiene. You know, things like that. You got to think. So you have steroids, anticoagulants or blood thinners. This is getting very common right now because a lot of patients, as they grow old, or maybe middle-aged patients, they start getting cardiac problems, and the doctors start giving them blood thinners to prevent heart attack, stroke, and blood clots. There are different levels of blood thinners. That's all of them. Okay. Aspirin is the very basic one. Sometimes doctors give them as a prophylactic. That means they are not having a stroke yet, but they give them just before to thin out the blood. Warfarin is the more severe kind. Okay, warfarin and heparin. And then you have the middle zone, Plavix or Ticlid. Blood thinners are indicated in patients with high risk of strokes or heart attack. Because the blood is too thick, sometimes it clots inside and it's not great.